This is the Fertility Friday podcast, episode number 75. Welcome to the 75th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from FertilityFriday.com, and this is your source for information about the Fertility Awareness method and all things fertility. If you've been listening to the podcast for a while, then you already know just how passionate I am about connecting you with the tools and information that you need to improve your menstrual cycle health and your fertility. And that's why I started the podcast in the first place, because I strongly believe that every woman has the right to know exactly how her body and her fertility works. And I feel so privileged to be able to share my passion for body literacy and fertility awareness with you each week. And you only have to listen to a few episodes of the show to gather that fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and your fertility. So if you've recently discovered fertility awareness, but you're not really feeling that confident about using it for birth control yet, or if you've been charting for a while and your cycles are all over the place, you can't figure out what's happening with your mucus, your cervix, or the random bleeding that you keep happening and you're not sure what's going on, I can help with that. I absolutely love helping women to connect with their cycles, and I can't wait to delve in with you and help you bring your cycles back to health. So if you'd like to work with me, you can actually set up a free 15-minute consultation by heading over to fertilityfriday.com/coaching, or just click on the work with me button on the website. And I would also like to invite you to sign up for the Fertility Friday newsletter. So head over to fertilityfriday.com/ebook, and as a gift to you, you'll receive a free copy of my new ebook, Where the F is My Period, where I reveal what to expect when coming off hormonal contraceptives, and I share 5 steps to restoring healthy menstrual cycles post-pill. If you have recently ditched the pill, my ebook actually provides some insight as to why your period may not have just bounced back the second you stop taking the hormones. And it also provides a bit of a roadmap to start bringing your cycles back to health. And in today's show, I'm very excited to welcome my guest, Megan Fowler. Megan is a fertility care practitioner, and so that means that she was trained in the Cretan model system, and she does have a role in NaPro technology. So I did do a show previously about NaPro technology, episode number 31, so I'll link that into the show notes. And in today's show, we'll be talking about NaPro technology and the role it can play in restoring fertility. So without further ado, welcome to the show, Megan.
Thank you.
Well, thank you for being here. So I'd love to know, I mean, there's lots of different fertility awareness models. So I'd love to know how you discovered Cretan and what kind of inspired you to go ahead and become a fertility care practitioner.
Yes, absolutely. So I was actually in college when I learned about just natural methods in general. I had never heard about it. I'd never really given it all that much thought. But I am generally inclined to choose the natural route, or to avoid, chemicals, medication when possible. And so as soon as I learned about it, I was interested in just general fertility awareness. And I began researching, and I found all kinds of interesting and helpful information. And from that point on, I was pretty confident that was a perfect fit for me. So I began, I learned more, and I eventually took a class learning this symptothermal method. So, you're taking your temperature and you're checking mucus. So that was my first method that I loved, because I love to see the, little shift that happened with your temperature. So cool. Confirmation of ovulation. So that was good. However, part of what I've been researching is, the more you learn about fertility, the more you learn about infertility in a way, when you start realizing there's so much that should be happening, but also may not be happening. And so I was kind of left with this question of, where do people go and what do they do? What are their options? In my experience, from media and, you just hear a lot about, okay, there's these things out there that you can do. So there's IVF, IUI, and you can, seek some medical treatment. But the more I understood what those entailed, I guess I wondered, is that a route I would want to take? Is there another option? Is there anything else? And so I was left with that question for a few years, just something, you kind of carry with you. And then one day I heard a radio piece on NaPro, and it was like, wow, that is what I was hoping was out there. And so if you don't know anything about NaPro or NaPro technology, it basically seeks to restore the health and the reproductive function when something has gone awry. So that is the main goal, is to restore optimal reproductive health. And along with that is just the overall health and functioning of a woman. And so for me, as soon as I heard that, it was like, oh man, and drawn to learning more about it. As time went on, I was at a place where I'd moved, and I was a teacher formerly. And so it was a weird place in the school year when I got married, and my husband and I moved for his job. And as it turned out, a Creighton training came available. And I just decided, I know I love a natural system. I love sharing about it with others. I feel like more people would benefit from its use, and NaPro offers even more than your standard fertility awareness methods. So I went ahead and joined that training, and that was in October of 2010. And I have been teaching the Creighton model system and referring to NaPro doctors ever since. So.
Mm-hmm. Well, yeah, no, thank you for walking us through that. And what I think is, I remember when I interviewed Danielle, so, I'd heard of NaPro, but I didn't have a lot of real specific information because I hadn't really searched NaPro specifically. And what's so neat is that it's like this wonderful kind of infusion between fertility awareness and medicine.
Right.
And so it's really neat because then you have like a medical doctor who's doing these tests specifically based on your charts. And I think that that's just an amazing thing. And obviously, I also think it should just be standard practice.
Oh, absolutely. So true. There's so many of the NaPro protocols that should be standard practice. And I think, there's just so many benefits. So like you said, they're using the chart, which is huge. And, along with that, I think it strengthens the relationship between the patient and their care provider. There's a greater level of trust and better communication. And so overall, I think the experience, for the woman's health, but also, for her heart is better. And I know a lot of times, or I guess I should just say from personal experience, going into an OBGYN, I've had good experiences with traditional OBGYNs, but I've also had some really poor experiences. And it is a very vulnerable relationship. Mm-hmm. And for it to go poorly is not fun, right?
No. Okay. No, not at all. One of the questions I wanted to ask you as well, maybe you could tell us a little bit about the difference between a fertility care practitioner, which you are, and then the NaPro doctors, and how you work together.
Great question. So as a fertility care practitioner, we are kind of the first or basic steps. So, we do the teaching of the fertility awareness or natural family planning methods. So just like there are symptothermal teachers of different methods, there are mucus only methods. And so we are a mucus only method, and there are a few of those. We are actually an outgrowth of what was the Billings method, and still is, I should say, the Billings method. And there were certain changes that were made by Dr. Hilders when he medicalized and standardized the system for fertility care. So I teach the charting portion. So couples come to me whether, they're referred by a NaPro doctor or they just, know they want to chart their cycle and they want to use a natural method. So they'll come to me and they will do an intro session, and then they will begin charting their cycle. Now, if they know they want to go to a NaPro medical physician of some kind, the doctor usually asks, and it depends on, I guess, on the particular doctor, but a lot of times they'll ask for 2 cycles to be charted. So while they're still coming to see me and, going through what is ideally a year-long program, because there's a lot of information that we cover and it's very thorough. Um, while they're coming to see me, they will usually at about month 2, they will begin to see a NaPro doctor at that time. So, um, and then from there, we as Crayon model instructors or practitioners are working to ensure that the client is confident in their chart, that charting is accurate. And we're doing those things obviously so that if they choose to use days of fertility or infertility, however they want to, plan their family growth, they can do that. But also, if at any time, now or in the future, they decide that they want to seek NaPro treatment, we want those things to be in place for the best possible, outcomes. So from there, it's really a matter of we support the client in their charting. And we will notice things in their chart that are related to NaPro technology, so signs or indicators, what we sometimes call biomarkers. And there are certain things that we can make suggestions for. So whether it's an over-the-counter supplement or, maybe something dietary that, we found to be helpful for certain conditions. But in general, most of the NaPro technology, the real medical portion is conducted by the NaPro medical physician. Now, a lot of times, couples or women will go into their NaPro doctor and they think as soon as they start seeing the NaPro doctor that they don't have to come back, for instruction. Which in some cases, if they've gone through enough sessions and depending on their chart and their cycle, might be kind of true. But something to keep in mind is the NaPro doctors, they are trained in reading the charts, but they are not trained in teaching charting, whereas, the opposite is true for us. And we are really trained in teaching accurate, confident charting, but we are, we're obviously not trained in medical protocols the way that they are.
Well, I think that's an important point because I feel like, having worked with women in the teaching aspect of fertility awareness charting, whenever you have the chart out and you're talking about it, there's always questions around not only what you see, but also the charting protocol. And so I could see that being a bit confusing, and I could see the doctors, kind of, I see why there's that relationship there between the three of you.
Right,
Essentially,
exactly.
yeah.
Yes. And so, some people think, well, I went to the doctor. She looked at my chart, and she did. And she may notice things that,
But from a different perspective.
Right. Exactly.
Yeah.
Exactly.
Yeah. No, that's really interesting. Yeah. And so maybe you could, so how long since 2010, so that's like 5-6 years that were going on here. So in that time, what would you say are some of the most common things that you've seen? Would you say that most women that you see have like healthy menstrual cycles, or have you seen any it must be too early, but have you seen any trends in terms of women's menstrual cycle charts?
Oh, gosh. I would say, and I don't know, I think there's a lot of reasons for this, but a lot of the charts I see don't look anything like, the charts that we have in our picture dictionary to refer to, or the charts that are in the user manual that we give clients. And so often clients are coming to me and, they're understandably concerned or anxious. And so that is hard because there are so many women who are dealing with, irregularities of their cycle. And that's, if you know anything about fertility awareness, that's not just cycle length, but where they're post-peak phase that we don't expect to vary, much. We expect it to maybe shift a day or two, but that should be pretty consistent. But where the post-peak phase is, very erratic, or where, mucus buildup every month is different, where they've got continuous, peak type or fertile mucus, and they're seeing that all cycle long. And then another one that I see that's really hard for, especially for infertility clients, is limited mucus. And these are some of these couples have been trying for years, and they don't know until they come and we sit down and we talk about it, that is absolutely critical, to their fertility. And they say they kind of paid attention. They kind of knew about mucus, but they had no idea how critical mucus was for, timing intercourse and just making sure that the quantity was sufficient for their fertility and their health.
Well, maybe we could talk about mucus a little bit. One of the things that I wanted to ask you as well, because you talked about the Cretan model and how it was based on the Billings model and how it's mucus only. And I think that a lot of women enter into the fertility awareness kind of realm from exposure to, say, taking charge of your fertility, or some of kind of the, or even Katie Singer's Garden of Fertility, which is obviously symptothermal. And the mucus aspect of it, I think, is different, right? Because when through the Cretan model, as I'm sure we can get into a little bit, mucus is so essential. And in terms of the model that you're trained in, it's the only thing. So one of the questions I actually got recently on my blog was, how effective is mucus? Like, kind of the thing, like, how could it really be that significant? So let's talk a little bit about mucus and how the model is effective, even though it's mucus only.
Yes, great question. It is incredibly effective. Now, I will say before I start, one caveat is, while I love the Creighton model system and it can be adapted for any woman with any kind of cycle, there are some women who find other methods to be a better fit for whatever reason. But I think in general, almost any method, when you're learning from an instructor and you put the time in, it can be effective for you and definitely usable. So there should always be a change in the type of mucus. For most women, I would say I see very few cases where there's no change, or where you can't actually figure out where the shift has happened hormonally based on the changes in mucus. But, even if a woman is having ongoing mucus, it should not be the same the whole length of the month. And if a woman is looking at it herself and, Googling or maybe even just reading a book, she might not be able to distinguish the difference between, where it shifts and what those, what that designates or what that, represents. So let's say a woman is having an stretchy, like an inch or more mucus throughout the month. Well, what we would expect to see when she is truly fertile, because that time of fertility is, the time when the estrogen is acting on the body and it's increasing with the ovarian activity that's happening. What happens with that estrogen is that mucus will change, and there should be a shift in what she's seeing. So even though she might still be seeing the same stretchability where there's a lot of stretch of her mucus, we would expect either, greater clarity, so more of a clear will appear, or maybe it's lubrication that she only experiences during that time. But there should be a shift. This is assuming that she is ovulating, right? That it is an ovulatory cycle, and all of that. But if there's a time of fertility, which there generally is, there will be a shift that happens, prior to ovulation. And then also there's a shift that happens after ovulation, because when that estrogen is, taken out, and that shift from estrogen dominant mucus to progesterone dominant mucus happens, just the nature of the mucus that's being produced will change. So, that estrogen dominant mucus basically creates like little channels for the sperm to swim through to reach the egg. And that's what makes the mucus, very stretchy, more clear, and very slippery or lubricative, where the progesterone dominant mucus doesn't allow the sperm to travel at all, and it's very sticky and there's not much of it, and kind of creates a stone wall effect for the sperm. So, there is a change that happens there. Mm-hmm. And beyond that, once we identify that point of change, we do have something we call yellow stamps. And so we can use those yellow stamps to say, yes, you are having what, in the system we define to be a peak type mucus symptom, or, just mucus all cycle long. But we are using these yellow stamps because we have defined that this time is different than this time. Mm-hmm. So there's a kind of a process that we walk through with clients to figure out, how are these days changing and how are they similar to each other, certain groups of days, and then how are other groups of days different from each other. And then we use that to distinguish those times for a woman. So mucus-only methods are actually very, very effective, just in the same way that symptothermal methods are. I think depending on personality type, some people really love, that external temperature and seeing it charted and seeing that shift, and that's perfect for them. But then there are other situations and times when a mucus-only method is maybe even better, depending on what sleep habits are, or, just different factors that can make mucus more effective and maybe provide more information. Or if you think you might want NaPro medical support, it's really the way to go for the full range of the doctor being able to use your chart. Whereas some NaPro doctors will take any chart and they will, try to extract that information. Some say you have to chart with Creighton. It just depends. But to get the fullness of it, you need to chart with the Creighton model system. So I would encourage people to find a good method for them, and just to know that if you are considering a mucus only method, that when you learn it with an instructor and you put the time in and go through the sessions, you can be very confident in using it.
Well, you touched on a couple of really important points. So one random thing that I'll mention is, as I had mentioned to you, I have a 6-month-old, and I'm breastfeeding. So for me personally, at this exact stage of my fertility awareness charting, I'm not taking my temperature. Why am I not taking my temperature? Because I might not ovulate. I haven't ovulated for at least, a year, right? And more. Right. But after I had the baby, I have not ovulated. And so to me, then it's not helpful for me right now to take my temperature because nothing's happening. And so it's much more helpful for me to check for mucus every day. So I just wanted to give like an actual example for the listeners who might be thinking, well, because when you first learn, especially the temperature, I find the temperature to be extremely helpful in identifying that ovulation, right? Yes. So just to give an example of when it might actually not be helpful or not provide anything useful, this is an example of that. But it doesn't mean I've given up the temperature forever. It just means that right now.
I think that's a great point, that there are different times. And I think breastfeeding can be one of those times. And I will say I don't know what your experience has been, but a lot of breastfeeding moms do experience ongoing mucus. But with that being said, there'll be a shift. I'm sure you are confident that when you see that shift, your body returning, to the, ovulatory function, you will notice a change despite what you're seeing now. There is something that happens. And, I think for those of us who've been charting for a while, we're confident in that. And yeah.
Well, I'm starting to feel like the odd woman out because I actually have, so I use the Just East charting system, and so it's like green days. So they're all green. So I actually have this basic, it's just
great.
So I feel like the odd woman. But anyways, for anyone who's listening that doesn't exactly know what I just said, so I'll say that in English. So every woman then would have what's called a basic infertile pattern. So and I wanted to ask you a little bit more about what you were talking about with the yellow stamps. But what that means is that there's a complicated question that I'm going to ask you after I'm done this, which is, when a woman is learning to chart, what we always would tell them is all mucus is fertile. But when we're talking about kind of basic, it's a more complicated conversation, and this is where having a teacher comes in. But basically, it just means that there is a small window of infertility, and if a woman is seeing mucus every single day, it's actually a different situation because she's not literally fertile every single day. So
Yes.
for her, her basic infertile pattern is that she has mucus. Um, so all that means is, in my example for me right now, when I check for mucus every day, it's dry every day. Whereas for some women who are breastfeeding, they check for mucus every day, and they actually have a certain degree of mucus every day when they're breastfeeding. But that doesn't mean that they're fertile every day.
Yes, exactly.
So, I wanted to ask you about that. So maybe you could just deepen into that a little bit in terms of the question that especially if you're part of any forums or if you talk to women who are learning fertility awareness, is really that is all mucus fertile and how do I tell? That's a complicated question, but how do you kind of address that?
That's a great question. And actually, I don't know if I've ever been asked that specific question. So, um, yes. So when you're starting out, we assume it is, right? We kind of have these rules to kind of safeguard, especially because, if a couple strongly wants to avoid achieving a pregnancy and they're just learning and sorting through it all, we kind of put all of these um, kind of buffer, right, rules into the way we teach. And we say, all bleeding is fertile because, you may miss mucus on those days. And we say any mucus that you can stretch or anything you feel that's lubricative is fertile. And we keep those for a little while, and then some of them change. So like an example of that is, on light and very light days of bleeding, and I don't know if Justice does this as well, but eventually, you say if you're checking for mucus consistently and there is none, we say, those light and very light days of bleeding at the end of a menstrual period, I should clarify that, are infertile. But we start by saying, just in case, we're going to assume this is fertile. And then if we see that this is a consistent pattern for you and you're able to check consistently and you're not forgetting, then if there's no mucus, they're considered infertile. So similarly to that, we do say anything you feel that's lubricative or any amount of stretch of mucus that you experience, even if it's just a small amount of sticky, we say is fertile, because a lot of this has to do with the statistics, of when they've studied what happens, because it can be fertile, right? For some women, that is the beginning of their mucus patch, and that's their pattern, where they will start with just a small amount of sticky tacky and then progress to, a greater quantity and quality of mucus. And for some women, that stretches over a wider window of maybe 7 days or, give or take. And for some women, it might be a shorter window of, 3 to 4 days. And just that initial little sticky tackiness later in the day becomes something very stretchy, and quite fertile. So, and we say in our system, sperm can live up to 3 to 5 days in good mucus. So, depending on the situation, we kind of have to say that that is all considered fertile until we see that a woman's cycle is showing, like you said, the base infertile pattern for that woman for some reason is different. And there can be, a multitude of different reasons for that she's seeing something else. But once we see that her consistent kind of normal is not what we would expect to be, right? We expect that normal infertile time to be dry and to have green babies because it is all dry time or essentially dry. So, but when it's not, then we say, okay, we know your ovaries aren't producing estrogen at the levels required, to prepare for ovulation and to increase the fertile mucus this entire month. And so from there, we kind of do some, analysis to identify when is the true window of fertility.
Mm-hmm. Well, one of the things that, so for anyone who's listening and is like, what the heck is a green day or anything like that? Each charting system is a little bit different. And that's one of the things. So there's a lot of different charting systems. And so essentially what a green day would mean is a day where there's no observable mucus, where you're actually dry and you have a particular method of checking that you learn from, a teacher, learn within a system. So I often talk about, the external checking in terms of like wiping with the tissue paper, because there's different methods of checking. So that's what a green day is. But one of the things that I wanted to also kind of point out is that when you're using a model like Cretin, or if you're using a model like Justice or Billings, then when you say sticky or tacky, it actually means something, because that has been defined. And that's one of the things that, for me, when I started learning the Justice method, that really clarified a lot of things for me. So, like when you're learning from a book, for example, and they talk about sticky, you think of sticky as, which is very subjective, right? Like sticky, like as if I spilt some juice on the floor and my, sticky. So then when you're talking about it and you have like, 1,000 women in a forum who are talking about sticky mucus, well, that is just, it doesn't really, it's so subjective that it's really hard to know. So what one woman's calling sticky, another woman could be calling something different. And then that's where that comes in, where you really want to know, like, all mucus is fertile. And that's where it really...
Right.
So how is sticky defined in the Cretin system?
So did you say how is it defined?
Yes.
Yes. Okay. So in Cretin, sticky, tacky, and stretchy are actually amounts of stretch. So they are not defining the consistency necessarily, which is confusing. And we have this confusion a lot initially until we, clarify and go through it, because people are just reading the words where, we do write on, it's on the back of the chart and in the handbook exactly what it means. But we kind of have our natural inclination to think of it a certain way. So sticky is up to 1/4 of an inch amount of stretch. And then tacky is 1/2 to 3/4 of an inch, approximately. And then if we say it's stretchy mucus, we're actually referring to a stretch of an inch or more of the mucus.
So then it's mucus that you can obviously pick up, and then you put it between your fingers and then you stretch it. And then whether it's sticky, tacky, or stretchy is actually how long it, how far you can stretch it before it breaks. And I feel like that specific distinction makes it so much more clear, because then it's not just a concept. It's not just a word. It actually means something. Yes. And it's very clearly defined. And any woman can look at their mucus and say, this is sticky because it only stretches 1/4 inch. Or this is tacky because it's not an inch. And then it
exactly. And that's part of, I think both of our systems, that they are very standardized.
Yeah.
Right. And that's a huge benefit for, especially when you take your chart in and a doctor is trying to read it. And that's a struggle that those doctors who, will read other charts and they're trying to decipher, what does this woman mean, when she's talking about her mucus, or writing it out in words, where we have it standardized and, it's converted to a charting system. So, there's actually numeric values that go along with sticky, tacky, and stretchy. And then it made me think of something else that I've seen in the past being an issue too, is, when people say egg white mucus, and some people are imagining clear mucus, the actual egg white, but then some people are thinking it's white, it's cloudy mucus. Just in color, right? I've seen that. Wow. So there are things that can be confusing when you're just reading it or you're just taking bits and pieces on the internet. So it just depends kind of what your goals are in using a charting system. And, if you want to avoid pregnancy and you're very serious, you've got some, reasons that are really important to you, very seriously intentionally avoiding pregnancy, then I would always suggest an instructor having that support. And then also, if you think you might want to take advantage of the medical benefits, I would also suggest using the Cretin system, but at least having an instructor to clarify it for you. So yeah, It is an interesting distinction.
Well, and since we're talking about mucus, so one of the other things that I really like about then a more systematized approach to charting mucus is that it doesn't kind of give women the idea that there's only like 3 kinds.
Right.
right? Whatever that means, because
Right.
it's not that there's three kinds. It's that there's kind of a continuum. And then there's also other considerations, such as color, that doesn't come into play when you're thinking sticky tacky egg white.
Right.
And so one of the things I actually wanted to talk to you about, so you know, one of the most common kind of scenarios for women who are listening to the podcast is that time around coming off of hormonal contraceptives,
Mm-hmm.
and and there's lots of different things that can show up, right? And even if a woman wasn't on hormonal contraceptives, a lot of things that can show up that can be unhealthy.
Mm-hmm.
And so I feel like if a woman is looking for stretchy mucus she thought like she has a couple days of stretchy mucus, and that mucus happens to be kind of yellowy or kind of like gluey, without having kind of a specific charting system or reference, then she might actually think that that's fine.
Right.
So, what does healthy mucus look like?
Yeah.
And what are some of the flags that would indicate that there might be a problem in terms of mucus?
Yes. Thank you. So, healthy mucus, there's cervical mucus that we discussed. And so that would be something that was, stretching somewhere from a fourth of an inch to even greater than an inch, sticky tacky or stretchy, in our system. So, it's got some stretch to it when you pick it up. And then we would expect the color to generally be a kind of cloudy white, or, some, cloudy clear combination, or clear mucus. And then in addition to that, there is a vaginal discharge that can be totally normal. And we say it's kind of like a pasty feel to it. By itself, it should never stretch more than a fourth of an inch, but sometimes it can be combined with cervical mucus. So that's something, kind of like a creamy lotion kind of consistency. If it's really high in water content, we say, can be kind of milky. So you might see that, on and off, and that's normal. Vaginal discharge, just normal, healthy vaginal discharge can look like that, and you can see it. Red flags would be any yellow. Now, yellow can be due to a really small amount of bleeding. And in that case, it might be induced by ovulation or a really small tear at the cervix, or, something of that nature. But in general, if you're seeing yellow and it's consistent, that's something to take note of. Some of the other things, if you are actually seeing red, red can be normal if there's a little bit of it and you just see it once or twice. But if it's ongoing, kind of this red or brown tinged mucus, that's something that you may want to have checked out. Definitely anything that's causing you irritation, itching or burning, or anything that you feel like has any kind of, offensive odor. It may have an odor, but there's like an earthy, normal odor, and then there's something that's slightly offensive. So any kind of offensive odor absolutely should be something that you seek, medical attention for. And the last one I think that, we see is something that's tacky, or something that's gummy, what we call gummy. And that would be like a dryness to the mucus. So it's got some stretch, but it's kind of very dry in its stretchability. And we usually compare that to like the glue on the back of the credit cards that come in the mail. Or, and that would be more of a smooth gummy. So sometimes it's smooth like that, but sometimes it's more of a clumpy gummy, but it's not going to stretch easily. There's something there that you can kind of stretch, but it's not, doesn't have a high moisture content at all.
Kind of like gum.
Yes. Yeah. Exactly. And so that does indicate some kind of cervical inflammation. And cervical inflammation can be caused by like childbirth. So ectropion is something that happens usually after childbirth, where at the cervix, some of the cells that are inside the cervix, or should be inside the cervix, are kind of starting to grow on the outside, because of what's happened and changes after childbirth. Now, that can cause ongoing mucus. It can also cause mucus that looks a little bit yellow to some degree if there's a little bit of bleeding there. And that's something that I've been told traditional doctors do not check for at all, because it's not really a medical issue, but it can interfere. It can be something that I guess women, don't like to see, this little bit of ongoing mucus. And it may be gummy or maybe not. But there is a treatment for it that NaPro doctors will do if a woman so chooses. So that's something else. But it can also be other issues with the cervix. So that's just one that's not really a medical concern, but there are other inflammatory conditions of the cervix that are an issue. So if you are seeing that gummy, that's something that you would want to have checked out.
Mm-hmm. Well, I'm so glad that we're going through this today. So thank you for that, Megan. And part of the reason, I did a podcast episode recently, because like you said at the very beginning, there's no one method that's going to work for all women. And I did an episode with Holly Griggs-Ball, who is now the ambassador for Lady Comp. And now, Lady Comp, as I'm sure you know, is kind of the temperature only method where a woman doesn't have to check her mucus at all. So then for someone like you or I who have kind of received training in like this crazy detailed like mucus charting system, it just seems so odd to just completely eliminate the mucus. But with that being said, some women just gravitate to that so much more for various reasons. And, Holly and I had a great conversation about why it's important to have those types of options. But with that being said, I think that for anyone listening who just listened to everything that you talked about with regards to what mucus can tell us, and that's only really, we really got into cervical health. That's not even what mucus can tell us about our hormonal cycle or our fertility or any of the, zillion things in the year-long process you work with clients that you get into.
Right.
So that's really the tip of the iceberg with regards to what we can learn from mucus. So I think it's important, although I understand, that every woman needs to find the charting system that works best for her. I feel like all women should at least know, even if it's not your thing, to at least know what your mucus could tell you so that you can make that informed choice of whether or not to check it.
Absolutely. Because I think one thing that is underemphasized is the importance of normal mucus and, what it says about your health, right? So the temperature, I mean, you could be ovulating beautifully or appearing to ovulate beautifully with this temperature shift and everything looks normal. But if you're not checking your mucus, you really are missing, or if you don't even know what to look for or what would be an indicator of a problem, you are missing a component that could tell you a lot about, your reproductive health and your overall health, right?
Yeah, absolutely. And so for anyone who's listening, maybe for the first time, so they just found this podcast and they tuned into this episode first of all episodes, and they're like, what the heck are they talking about? This is so much information. Yeah. Could you take us through kind of, how at the beginning you talked about that many of the women that you see, they don't look like the textbook kind of picture of charts that you have in your training module. Mm-hmm. So what does that textbook healthy cycle look like? I mean, just briefly take us through it.
Sure.
And then, let's start there.
Okay. So, with the beginning of a menstrual cycle, we expect to see something that gets into a actual flow relatively quickly. So we do not expect to see a lot of days of premenstrual spotting. One day, maybe two. For some women, there may not be any. So the two options for what we expect to see, just thinking of the beginning of the cycle and with the menstrual flow, is either something that is crescendo, decrescendo. So it is increasing to a full flow relatively quickly, and then it comes down. So that would be like, light day, medium day, heavy day, 2 medium days, and then a very light day at the end. So, kind of starts slowly, but then quickly becomes more of a true flow, and then it decreases and comes down again. Another option for a healthy, normal menstrual flow is something that starts very heavy and then from there kind of tapers off. So you may have a couple heavy days, medium day, a light and a very light day, and then the menstrual flow is over. So a mark of a true menstrual period is always either a heavy or a medium day. If you're not having, heavy or medium flow, we're concerned that you are not ovulating and that what we're seeing is not a true menstrual period. So, and then the length of that, approximately 4 to 7 days, somewhere in that range.
And can I just
Yeah.
poke in? Do you quantify medium or heavy?
Um, I think we say in this in the system that a heavy day or heavy flow would be like changing a menstrual pad or a tampon. I think it's like every 2 to 4 hours is what we think of as heavy. And then medium would be, I guess, like 4 to 6 hours in terms of changing. So somewhere in that range. Um, and then at the end of the cycle, you may have a little bit of brown spotting, as the end of your cycle kind of clears out. But if we see 3 or more days of brown spotting or little bits of brown bleeding, um, that that indicates that something may be going on. And a lot of times it has to do with the progesterone in the previous cycle. So a little bit of brown is okay, a day or two of brown spotting. More than that, and it can be pointing to something going on hormonally with the cycle. And then from there, what we call a post-peak phase, and to think of that just generally, it's the time prior to ovulation. So from the first day of your menstrual period up to and including approximately, I should say, the day that you ovulate. That time can vary a lot. And, we go over quite a bit in our system what can happen if a woman is stressed. And this could be a positive or negative stress. So it can be, a wedding or moving, or it can be illness, loss of a loved one. But if it's something that is acute, so, it's just happening for a short time and then that stress is let up. So it's not an ongoing, kind of my job is stressful always, or, my family life is stressful always, but it's something that, happens for a short time and then is let up. It can impact the woman's body and her cycle and push out her ovulation. So with regards to, women will come to me and say, I don't always ovulate on the same day. My cycle is not always the same length. And, I say, that's okay. It's within the normal range to have some variation. And even without having a stress cycle where your ovulation is being pushed out, and you may see, and that may go along with 2 mucus patches that, you might see, there's just, a few days of variation for some women in that pre-peak phase of their cycle. So what you would expect to see when that ovarian activity picks up is some shift. So we say, typically that is when you go from dry to any kind of mucus. But like we discussed, it may be you're already seeing some kind of mucus, but there's a change in the kind of mucus you're seeing. So it's going from less fertile to more fertile. And then we would expect that time to last. I mean, it varies for every woman. At least 4 days, maybe, upwards of, just over a week or so where you're seeing that mucus. Now, we do see women who have very little, just 1 day, or we see dry cycles. But we would expect in a healthy cycle to see a mucus buildup where there is, eventually, as the woman gets closer to the end of that mucus patch, she is seeing something that feels lubricative when she wipes, so a really slippery sensation, something that is stretchy, and or something that's clear when she stretches it between her fingers. So that is normal and healthy. And then after that, there will be a shift. And, she'll either go back to her base infertile pattern, generally speaking, or she will go back to, days of dryness. And that post-peak or post-ovulatory phase, also, we call it the luteal phase, generally should remain very consistent. We expect to see it in a healthy cycle. I would say probably a minimum of, 10 to 11 days minimum. And then, depending on the woman's health, and also if she's been, well, yeah, I'll stop there. So somewhere to about 15 days. That's kind of the normal range of when the cycle, or when that post piece of the cycle would occur. So, yeah.
Yeah.
So that's what we would hope to see for any healthy woman.
Okay. And then for women who have recently come off of hormonal contraceptives, maybe you could touch on that a little bit, what that process looks like, because I think a lot of women, especially when you first find out about fertility awareness, you finally get the courage to go off the pill. You're so excited to see your charts and they're a mess. So maybe you could talk a little bit about that process and how long it takes generally for a woman's cycles to start looking more healthy.
And there's a lot of variance here. And it depends on so many things, how long a woman's been on the pill, her overall health, how her body reacted to the hormones that she was on. So for some women, they can come off and have relatively normal cycles pretty quickly. And, the first few may or may not be ovulatory. But, a lot of times, I think what we see is irregular cycles, irregular bleeding, because the woman's body has not been having a true period. So that kind of shift in the woman's body kind of having another period again, and what sometimes is a true period and sometimes it's just withdrawal bleeding. But it can take I'd say 6 months, and unfortunately upwards for some clients. And things can just be kind of all over the place. It just really depends on that particular woman. But it's actually hard. It can be very hard, especially for women who are coming off and wanting their cycles to be normal, or women who want to achieve, right?
Yeah.
Who have thought, okay, I'm using birth control, and then I'm going to come off, and then I'll conceive, right?
Yeah.
And so, yeah, that's hard. It can be really hard when they're ready and their body isn't ready yet, and they haven't. There could have been issues that were going on prior to going on the pill that now are showing themselves, or they're coming up in the charting. Or, there are sometimes issues that have been induced by the use of the pill. So, so I would just encourage women who are thinking about coming off the pill, don't be afraid, work with an instructor, and then know that there's a great deal of variation in what you can expect, but that overall, seeing your true cycle and letting your hormones, manage your cycle is overall best for your body, and it's a good place to be.
Yeah, no, thank you for that. Yeah, absolutely. I agree with that. And I think I always ask that question. I think it's easy to hear or easy to say, but I think for the women who are going through it and experiencing it, it's just extremely frustrating, especially that fear of like, well, my cycles don't look normal. Is there something wrong with me? And I think it's important to know that it's going to take your body a bit of time to kind of figure itself out, especially depending on all the different factors, like how long you were on it and all that kind of stuff. So kind of getting towards the end of our interview today, I recently had a question from one of my listeners regarding NaPro, and she was thinking about going to a NaPro doctor. So one of the things she was asking was basically like, okay, so I know when you do NaPro, you're going to a medical doctor. She's like, do they do natural stuff? Like, is it natural or is it medical? Like, is my NaPro doctor going to be okay if I'm going to an acupuncturist too, or whatever? So maybe you could talk a little bit about that.
Yes, absolutely. It's a great question. It is a medical, I guess I should say, NaPro works within our Western medical system. But that being said, I think it's the best option for reproductive health. So It is not all natural. The goal, once again, of NaPro is to restore the woman's health and fertility and, ideal optimal reproductive function. So that is the goal. So when you think about what NaPro doctors do and how they orient evaluation, diagnosis, treatment for something like infertility or even endometriosis, their process seeks first and foremost to restore that natural health. Um, where, if you go to a reproductive endocrinologist, a lot of times it's kind of a bypass the
Yep.
woman's health, right? Where it's a total. And what's hard to know about that is that some women think this is their only option to go to a traditional reproductive endocrinologist. And I think so often, not only is the treatment bypassing their health, but it can leave you, in a worse place, health-wise, hormonally, within your body. So I would say most NaPro doctors are very open, even though they are Western medically oriented. They work within that model. So there are medications used. The OBGYNs do surgery. But there are differences even in what kind of like hormones they'll use. So they make sure that they use bioidentical hormones, not synthetic hormones. And their doses are often different. So where a traditional doctor, you're having trouble conceiving and they will give you large doses of Clomid that you may or may not react well to, NaPro doctor will start with very small, minimal doses of the Clomid and work the way up if necessary. So they're very conservative, and I've also seen where NaPro doctors make sure that whatever they're using, whatever kind of medication or drugs, it's not causing ill effects. So I had a client who was put on something that may cause ovarian cysts. Well, the NaPro doctor brought her in every cycle to make sure that it wasn't doing that for her body. So just very cautious and very thorough. Now that being said, our local NaPro medical consultant is very supportive of natural options as well and kind of natural means of regulating the body. So things like, removing BPA, she always recommends, she'll a lot of times suggest that clients try going gluten and dairy free because it just can have such powerful results for so many people. Let's see, what are some of the other things? Oh, she's big on sleep hygiene.
Mm-hmm.
So, the not looking at backlit blue lights within, she'll say, an hour and a half to like 2 hours before bed. Or I guess she says if she has to do her charting and kind of catch up on work, she says she wears the blue blocking glasses. So I think, more and more, NaPro lends itself to the kind of doctor or physician who's open to, where science is going and kind of it's really more of a holistic approach to health and reproductive wellness.
Well, and what I love about that Danielle really talked about in the interview that I did with her, was just that distinct difference, like you said, between looking at the woman's actual menstrual cycle and trying to work with it and to improve the health of it, instead of just like, forget that, let's just get with the hormones, like IVF, for example. And I'm neither saying it's good nor bad in the context of this, but what I'm saying is that it's a different approach. So instead of working with the woman's menstrual cycle, you basically give her synthetic hormones to totally just bypass whatever is happening there and create like a new fake cycle that works within that medical model. So it's just a totally different perspective. I think it's really important, as you said, for women to know that they have other options.
Right. And to do that without first studying the woman's own cycle, right? To know if, hyper stimulating her, ovaries is necessarily what she needs. Or, it's kind of crazy to think about, right? To not try to figure out what's going wrong before you implement a treatment.
Well, and we talked a lot about the different issues with mucus and the different things that mucus could show, and if a woman has continuous mucus, etc. But I think that the thing to know is that if those kind of cycle abnormalities are present, the whole purpose of NaPro is to identify them and then treat them. So it's not to say that a woman should necessarily have yellow stat management for the rest of her life, right? Like,
Exactly.
if
Right.
she happens to have continuous mucus, then those things are addressed through this process.
Yes, exactly.
All right. Well, some final questions just to bring our show to a close. What would you say is the biggest myth about fertility that you would like to see corrected?
Oh, that's a great question. I mean, and there's so many, right? The biggest myth about fertility I would like to see corrected. Um, I mean, honestly, I think, and I don't know if this is a myth, but I think our society's orientation to our fertility is something that I would like to see shift, where we appreciate, what really is a gift of our fertility and learning about our bodies. And that's something that's normal and natural and expected versus, this fear. I feel like the time, at least for me, like the culture I grew up in, the messages from society were, you fear your fertility. You don't really talk about it. You don't really learn about it. It happens and it's a scary thing and you don't want to get pregnant, right? Like,
absolutely not. Ever.
Right. Like whatever you have to do, just don't get pregnant, but don't learn about what's happening in your body. And so my hope is for, and I think it's already happening. And I am like very hopeful that for our next generation, that there's a total shift in our orientation towards our fertility and our knowledge of ourselves. And that it's not scary and that, we will benefit more than we realize from understanding and appreciating our bodies and our fertility.
Yeah, absolutely. And as a practitioner then within the fertility awareness world, what would you say is the biggest myth about fertility awareness methods in general that you'd like to see corrected?
Oh, that they don't work, right? This idea, and we see it all the time in articles, and even in medical texts where they really brush it off as something that does not work, is ineffective, takes too much effort, and is not worth our time, when I think it's couldn't be further from the truth, right?
Yeah, no, absolutely. Well, and final question of the day. For a woman who's currently on the pill or another hormonal contraceptive, and she doesn't want to get pregnant now, but she is thinking about pregnancy within the next couple of years, what advice, if any, would you give to her?
I would say find an instructor. And honestly, I would say begin charting your cycles now. We do require one cycle, or we suggest, we don't require it, but we suggest one cycle, that you would be abstinent, 1 month or one cycle, whichever is shorter for that time. But it is incredibly effective when used, with the intent to avoid, and when used accurately and confidently, because, in that time, there are so many things that may be identified and confidence gained. And whether that is, things that can be treated medically and taken care of out of the way by the time she's ready to conceive, that make her overall feel better, healthier, more energetic, everything more in balance. Or maybe that is just that she's learned her body, and so when she wants to conceive, she can do so more quickly and with less frustrations, hopefully, or less delay. So I would really encourage women to not be afraid of jumping into a natural system. It is a shift, but there are many methods, and there's a method that will work well for you.
Mm-hmm. Yeah, those are great words to end on. And for anyone who's listening for the first time, I've had the question before, women saying like, can I chart while I'm still on the pill?
Mm-hmm.
And I've actually, the answer, some women would say, and I think it's a good, you can actually get into the habit of checking while you're still on the pill, which is a great habit to get into, like in terms of checking your mucus and taking your temperature. However, you're not going to see a whole lot of information that's going to be useful until you actually get off the pill.
I think that's a great point. So with that being said, for any woman who's not ready but wants to be ready, I think, go ahead and start learning and get into the habit and the routine of checking. So it becomes second nature. And when you're ready, then you can go ahead and take the jump and see your actual cycle, which will be different than what you're seeing, from while you're on your pill, which is a hormonal induced cycle appearance, right? But there are two components where you are learning the system, which is, its own task in itself, and then there's seeing what your body is telling you. So
yes.
I think that's,
absolutely. Well, Megan, it was just a pleasure talking to you today. It's so fun talking to other practitioners. It's one of the benefits of doing this podcast. I really appreciate the work that you do, of course, the work of Dr. Thomas Hilgers, and it's really incredible the difference that he's made, who knows how many women's lives, by the work that he's done. And even methods like Justice were derived in part from the work that he has done. So just in terms of the work that you do, I'm always thankful that there are NaPro doctors out there.
Yes.
Improving fertility, like one uterus at a time. Like, thank you. So thank you so much for being here today. And for our listeners who might want to find out more about you or more about NaPro in general, where would you direct them?
Yes. So I work with another practitioner at Restore Fertility Care. We are located in Southern California, but we take on long distance clients, so we can work with clients anywhere. And you can find us at www.restore, RESTOR, fertilitycare.com. So that's our website. And you can also find us on Facebook. We offered one webinar on infertility and how NaPro approaches it. So there's some more specifics of how NaPro is different. So you can find that on our website if you want to watch. And we will also be offering webinars in the future too. So,
okay, great. Well, I will link to the webinar, to the website, as well as the Facebook. So for any of the listeners, you don't have to write all that down. Just go to fertilityfriday.com/75, the number 75, and then you will find it. So thank you so much, Megan.
Thank you. It's a pleasure.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/75. If you've been enjoying the podcast, please do look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com and join my email list. If you have an idea for a podcast episode or a guest suggestion, also send me an email at info@fertilityfriday.com. I love hearing from you. And remember, you don't have to figure it all out yourself. I absolutely love helping women to connect with their cycles, and I can't wait to delve in with you and help you to bring your cycles back to health. So if you'd like to work with me, head over to fertilityfriday.com/coaching, or just click on the Work With Me button on the website to set up your free 15-minute consultation with me. Thanks again for hanging out with me today. I appreciate all of you for taking the time to tune into the podcast and letting me be part of your day. So whether you're going for a walk or a run, taking the dog out for a walk, I always do laundry, or I'm always washing dishes or something like that when I listen to podcasts. So whatever you're doing, thank you so much for letting me be part of your day. And as always, until next time, be well and happy charting.